Get it, ready, ready.
And robotics came into the picture. Now with robotics, the surgeon is very comfortable. He can see the entire operation in 3 dimensions. It causes very little chest wall trauma. You saw in minimally invasive, we are making small cuts, 3 inches. In robotic, the incision is going to be 0.8 centimeters or 8 millimeters. That is the size of the cut. Which means the size of the cut that is required to do heart surgery has come down to almost the tip of your finger. It is as small as that. And it's practically unbelievable that surgery can be done like this. Of course, it has limitations. One is the major cost of acquiring a robot. And second is that tremendous amount of training, usually a couple of years is required before somebody can call himself an expert in robotic surgery. These are just a few pictures. The press might find it very interesting that robotic surgery is done through as something that is unique and tremendous, and we see that the future is going to be about robotic surgery, whether it is heart surgery or any other surgery. This is a very, very important and a very major milestone. 500 cases is not a small number. And for those of you who don't know, India is now at the helm of robotic heart surgery. And we are one of those centers where the entire world recognizes the amount of work that is being done. So I'm not going to take away what Dr. Yusuf is going to speak on. I'm going to speak a little bit on the other aspects of robotic heart surgery other than bypass surgery, what we also do in Bangalore, and I'll leave Dr. Yusuf to speak. So this presentation is going to be very short, probably for a few minutes only. The reason that we all want to move away from conventional open surgery is the complications associated with open surgery. Most important is infection of the sternum or the breastbone, and we want to move away from that. And whether it is minimally invasive surgery or robotic surgery, the goal is not to cut the breastbone or sternum.
Hello everyone, Vanakkam. Tamil I'll try to say as much as possible. And I'm originally Tanjavur, Chennai so I can speak Tamil very well. So இன்னைக்கு we are very thankful to you all and Chairman for being here. Thankful to you all and Chairman for being here to encourage us to do more. And when I went and met the Chairman 500 Panirko eventually partner, immediately he said this should reach out to the people. Because as you know, he has always brought technology and new therapy to India. Successful, he said we have to reach out. And Bangalore is also doing good numbers. So he said as a group we have the highest volume in the country. So we have to reach out and inform and benefit more patients. That's the whole idea. If you reach it will be beneficial. So every robotic cardiac surgery now Dr. Satyaki I will add on and say what he was trying to say in his talk. So almost 2000 first robotics was introduced for heart surgery. But it didn't take off. Upper surgeons were learning to do that minimal invasive techniques. Again, we restarted in India in 2019 June. Soon after, Bangalore also started. So as a group, we started to progress together. Now robotic assisted procedures maximum numbers. In Chennai, 500 surgeries more than 500 now. And we are the largest program in the country. This is particular the bypass surgery. One technique is our own technique. And this is one of the highest numbers in the world, not just in India. So this is where we are at the moment. So the robotic heart surgery advantage when it started, minimal invasive heart surgery, the chest open is a big benefit. Now, heart surgery first fear is bone cut, recover 3 to 6 months. This is minimal invasive surgery, avoid chinna cut sides. Now through holes and very minimal 3 to 5 centimeters cuts lay, everything is being done. This is no progress. Soon we will be at a stage where just folds and most patients can go home in 24 to 48 hours. Now we have achieved, but in some patients. So initial benefit, this is the most recent paper published in a big journal. First benefit of robotic assisted heart surgery initially was thought to be only reduced hospital stay, 2 to 4 days, and recovery within 2 to 3 weeks. But now, with more and more surgeons performing the surgeries better, advantages are also reduced complications. Infection almost zero in the 500 patient series, we have had no infections. And other complications, lung complications, bleeding, pain, ellame romba koraivu. Adanal overall outcomes has been better than open surgery. This is in the recent years, which is published. This is across the world. So, if enna surgery robotic assisted most adult heart surgeries, valve repair surgeries, valve replacement surgeries, bypass surgeries, tumor, cutting a hole in the heart. So almost all adult heart surgeries. In our practice, almost 80% of surgeries or more, we don't open the chest. That is the biggest advantage. And it is teamwork. It needs a team, it needs infrastructure. We have tremendous support from our chairman and our team here, Dr. Venkachalam, Dr. Naveen, Mr. Shokmar and team, and the whole team have put this together and they helped us grow. I have our anesthetist, Dr. Ganapati here. They have been our backbones. In fact, some of the techniques we do, avangala suggest pannadum. So we do it together as a team. Cardiologist, my perfusionist Neelakandan, who is like my right hand. So he has been with me for 10 years. We all train together and do it. Scrub nurse, perfusionist, ellarume. So adanala da idu ella edathilum panna mudiyala. But within the group, Apollo group kulla pathina, we have been training other surgeons. So Calcutta aarambicchitom. But we are looking at other centers. Delhi I go and operate and we have started there. Bombay and Hyderabad, other places we are looking at starting. So, this is an advantage. Surgeon comfortably sits in one place and we see it 10-15 times magnified through HD camera. So, that is one big advantage. That's why valve repair surgeries are open better. And this is the holes by the side of the chest. So, bedside my assistant will be there and they will keep changing. This is the end of the procedure, patients go home after bypass surgery. Dr. Satyaki right side valve surgery, this is bypass surgery. So patients go home. I know our chairman's dream was to send patients home within 5 days. We send them home in 3 days now. Or even less with single bypass, second day. Day 24 hours, we have discharged patients, 2 patients within 24 hours also. But most patients second day. 3 to 4 days, almost all patients are home, including old patients. This is a very benefit to the group of patients. Unfortunately, in our country, a lot of these bypass surgery patients are within 40 to 60 years of age. They are the breadwinners. For them to go back to work is very important. 2 to 3 weeks they can go back to work, manual work or anything. That is a very advantage. Another big advantages group is the elderly, 70 to 90. The oldest we have operated is a 93-year-old. So in the group, there are problems. Open surgery is a no-no. In the robotic surgery, they recover very quickly and go home within 3 to 4 days. Most of them within 5 to 7 days. So advantage of robotic surgery, there is no pulling of ribs. This is so day 1, patients start walking. So diabetic patients, healing of the leg is a big problem. This is the cuts. Chest arteries. So long term it is very beneficial. So long term most of the patients do not have problem for life. That is one big advantage. Short cuts, so less pain, less hospital stay. So not only it is good for patients, good for surgeons also. We sit comfortably and do things much better. So this is already சொன்னது. They return very quickly. So most of the patients பண்ண முடியும்னு சொன்னது. There is a small group, previous lung surgeries or அல்லது ரொம்ப continuous ongoing pain emergency பண்ற operations இதெல்லாம் பண்ண முடியாது. மற்றபடி most of them we can do. And gradually we have moved on. Single blocks and multiple blocks, high risk patients எல்லாமே. That I have to really thank my anesthetic team and Dr. Venkatachalama, DMS, for pushing me through the extremes to say you can do it, but do it gently and take your time and give the best outcomes. Adu avangaloda feedbacks have been really good in making me progress to what we are today. So this is our numbers over the last 5 years. So idhula pathina elderly group வந்து 25% of the patients, 30% nearly. So they really benefit. And multiple blockages is almost 2/3 as well. We have extensively published our work, which is important for the world to know what India is doing, what Apollo is doing, what we are doing. So not only in the Indian journals, with the international journals, and our technique has been taken up as a unique technique for surgeons to train. So this was presentations also. We have presented in the American meetings our technique, and we have been invited. Dr. Satyaki already சொன்னார். எங்களோட workனால we have been invited in the global platform to present our work and to coordinate regarding robotic training and whatever is available. Adala வந்து we did webinars, both of us have done internationally. The other important thing is proctoring and training, which is a vision, chairman's vision. He always says bring new therapy and அதை மற்றவங்களுக்கும் கொடுங்க. நாங்கள் வந்து அப்போலோ குரூப்புக்குள்ள மட்டும் ட்ரெயின் பண்ணலை. Across India, 15 centers we have started, including public sectors. So that is where we have been extending our work and training. So who are the suitable patients? Now, for most patients, the major benefit is in diabetic patients, multivessels, where we use arteries. And the arteries use பண்றதா surgery benefit over stenting. அது இங்க எல்லா வெசல்ஸ் யூஸ் பண்ண முடியறதுனால the most 90% patients do not have problem for life. That is a big advantage. Hospital stay is shorter, quicker recovery with less pain, less trouble and advantages. But it is a longer learning, as my colleague Dr. Satyaki already mentioned. And our advantage as a group is we interact a lot. When we wanted to start the valve program, I spoke to him and we started. So when we did certain things with CABGs, he talks to us. So that is one big advantage we have being in Apollo and having the infrastructure. Thank you.